Good morning, good afternoon, and good evening, everyone. Welcome to the webinar series of MiFOOD. This is the eighth webinar. It will be on urban household food security and its relationship to resource access disruptions under COVID-19. This is the first webinar of the MiFOOD webinar series in 2023. My name is Zhenzhong Si. I am the research manager of the MiFOOD project here at Balsillie School of International Affairs in Canada. The MiFOOD project, the Migration and Food Security project, aims to design and implement a new and innovative global research and knowledge mobilization agenda focused on the interactions between migration and food security within the Global South. So the project is funded by the Social Sciences and Humanities Research Council of Canada. It's being implemented by the Hungry Cities Partnership, or HCP, which is a research collaboration between over 90 researchers and partner organizations in 13 countries. To learn more about our project and also various other research projects going on in relation to food security and migration, please check out our website at hungrycities.net. Before I introduce our speaker today, I'd like to express the gratitude and appreciation to the indigenous people whose territory we reside on, and to understand our place within that history. I would like to acknowledge that Wilfrid Laurier University, which the MiFOOD project is affiliated with, and its campuses are located on the shared traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. This land is part of the Dish with One Spoon Treaty between the Haudenosaunee and Anishinaabe peoples and symbolizes the agreement to share, protect our resources, and not to engage in conflicts. From the Haldimand Proclamation of October 25th, 1784, this territory is described as 6 miles deep from each side of the river, the Grand River, beginning at Lake Erie and extending in the proportion to the head of the said river, which them and their posterity are to enjoy forever. The proclamation was signed by the British with their allies, the Six Nations, after the American Revolution. Well, despite being the largest reserve demographically in Canada, those nations now reside on less than 5% of their traditional original territory. Our speaker today is Dr. Cameron McCordick. He is an assistant professor in the School of Environment, Enterprise and Development, SEED, at the University of Waterloo here in Canada. Cameron's research interests focus on sustainable urban development, urban food security, and social vulnerability within cities. In particular, Cameron is interested in the systems that give rise to sustainable development and compounding vulnerability within cities. In pursuit of this research focus, Cameron has collaborated with communities, private enterprises, municipal leaders, and academics to find innovative research methods that can be used to investigate urban issues through a community-based research framework. The research Dr. Cameron McCordick is going to present today is co-authored with Bruce Frayan, Naomi Sunu, and Claire Williamson from the University of Waterloo. And welcome to the webinar, Cameron. It's a great pleasure to meet you after a long time.
Yeah.
For our audience, just quick notes that we will have 20 minutes after the presentation for Q&A. So please post your questions and comments in chat. Without further ado, please join me to welcome Dr. McCordick.
Great. Thank you so much, Zhenjiang. And just to confirm, Zhenjiang, you can hear me okay as we
Yes.
start. Okay, fantastic. Thank you so much for having me today. It's a little bit intimidating, I'll have to be honest, for a couple of reasons. One is that a lot of the people attending this talk actually were involved in the collection of the data or the analysis of the data. So I feel like I'm talking to people who in some cases have very unique vantage point on this analysis. The other reason it's a little bit intimidating is that I am actually just getting over a cold, and so I've taken Tylenol Cold to kind of keep myself in check, but it means I can't feel my feet at the moment, which is why I'm sitting down for this presentation. So you'll have to forgive me if anything comes off as intelligible, and just please put that in the questions for after the presentation. Thank you so much for joining me for this presentation. Oh, and there's Ezekiel. Hi, Ezekiel. Thank you for joining. Ezekiel and I work together on the Mozambique data in particular. What I'm going to do is I'm going to share my screen now, just to start the presentation. And let me see if I can get this working. Okay, looks good. Okay, there we go. And I'm going to just get the annotation set up. Okay. So thank you so much for joining me this morning. So for this presentation, what we're really working on is trying to understand the implications of resource access disruptions for urban food security. And this was a really interesting topic of conversation early on in the pandemic, and for some sectors of the economy, it's still a very relevant topic of conversation, for instance, with the shortage of microprocessors that we're observing now. But we've seen these supply chain disruptions occur over COVID-19. And what we realized was that we were in a unique position, having been part of the Hungry Cities Partnership, to start to try and answer some of the questions around what these resource access disruptions might mean for food access within cities around the world. And part of that was because we had collected so many surveys from around the world, from cities around the world, and we're in a unique position to answer that question. And one of the things that we found early on in our research using the Hungry Cities Partnership data was that there seems to be this co-occurrence of inconsistent household infrastructure access with household food access. And this is a very strong predictive relationship that kept on showing up in many of the surveys that we were doing. We found that households tended to go without food if they were also going without access to electricity or access to cash income. And we had a couple of theories about this. One theory that we had was that this may actually be the representation of poverty within cities, that it is this multidimensional experience within cities, that households don't just go without access to food, they often also will go without access to electricity or medical care. And so that could be something that we were seeing as observed by Midland and Satterthwaite on their work on urban poverty. The other possibility is that we could also be observing the trade-off of assets or the trade-off of income in securing access to these different resources or to food. And so when you have a limited income, you have to make choices about which resources you're going to maintain access to or whether you're going to maintain access to food. And so we could be observing this growing number of resources that households have inconsistent access to because they're trading off income in securing some resources and not securing other resources. But there was a problem that we found in trying to apply this research to the discussion of COVID-19. One of the problems was that we were really only looking at food access. We used the HFIAS, which is the Household Food Insecure Access Prevalence Scale, which is a measure of food access. And we know that food security is a multidimensional topic that covers the utilization, availability, accessibility, and stability of food access over time. And so we needed something that's going to be a better representation of food security than just a food access scale. The other issue that we ran into was that our studies were really constrained to Southern Africa. Most of our surveys were coming out of Southern Africa. They weren't coming from other places. And so we really had to establish whether or not this relationship existed in other cities outside of Southern Africa. And so as a result, we set for ourselves the following research objectives. First of all, we really needed to create this internally consistent index of urban household food access, utilization, and stability, a broader, more multidimensional measure of food security. And then we also needed to assess whether the relationships we'd observed in Southern Africa were also present in other cities around the world. So we had to use a larger data set to assess that relationship. And so within the context of this presentation, I'm going to first of all go over the food security scales or food insecurity scales that we use to build our index, and then I'll talk about how we built that index. So this includes a scale normalization, making sure that all the scales were brought onto the same scale, as well as the method we use for aggregating those scales. How would we assign an average score across those different food security scales to present our overall index of food access, utilization, and stability? Once we designed that index, we then use it to assess the relationship between food security and resource access. And here within the context of this paper that we're presenting on, we really talk about correlation analyses within the different cities to see if food security is correlated with resource access. And then we used a classification and regression decision tree algorithm to understand whether or not there's very heterogeneous relationships within each city. One of the early questions we had was whether or not the relationships we observed in Southern African cities could be generalized to other cities around the world. So it was very important that we try to understand the quality of the relationship between resource access and food security within each city, as well as to observe whether or not there were any generalizable phenomena about this relationship. And then I'll complete that presentation with some conclusions at the end of the presentation. So that's the approach that we're going to take within this presentation. And really to start us off, I want to talk about the food security scales we use, which were drawn from 5 different household surveys. In this case, as part of the Hungry Cities Partnership and in collaboration with many of the people who are on this webinar actually, we carried out a household survey in Mexico City, Mexico in 2016, in Kingston, Jamaica in 2015, in Maputo, Mozambique in 2014, in Nairobi, Kenya in 2016, and in Nanjing, China in 2015. Now, the unique opportunity we had here was that virtually the same household survey instrument was administered in each one of these cities, containing the same scales that measured resource access as well as food security. And so that put us in a unique position where we could actually compare across these cities as well. But there were 2 challenges we observed here. The first challenge being is that we noted that the survey sample sizes were different for each one of the cities because of the different survey sampling strategies that were used in each city. And that size of the sample could affect the relative weight that each city contributed towards some of the tests that we provided. So for example, if we're using chi-square tests of independence, that would be highly sensitive to the size of the sample we were using that would determine the tests of statistical significance. And so what we decided to do was take a random sample of 500 households from each one of the cities. Now, the second challenge that we had was that we really are looking at cluster data. So the relationships probably are going to be unique within each one of these cities. And that means that we have a series of what's called intercluster or intra-cluster correlations, which means that the data we're using is very difficult to model. We would have to either use multi-level regression analysis or something similar to be able to effectively model that data, recognizing that there are some relationships across the cities, as well as relationships that will be unique within those cities. Because we had so few cities involved in this analysis, with only 5, we decided not to go with regression analysis and instead use a decision tree analysis using classification and regression trees. And this allowed us then to look at the quality of the relationship between resource access and food security, while also taking into account whether or not this relationship changed within any one of the cities. And we're going to be getting into that methodology in a second. So that's the background. We collected these household surveys with the Hungry Cities Partnership and in collaboration with many of the people on this webinar. And then what we did was we started analyzing the food security scales. And in this case, there were 3 primary food security scales that were used in our survey. The first was a household dietary diversity score. Now, this is a measure of the number of food groups that any member of the household might have consumed in the last 24 hours. So if a household member consumed any of these food groups, we would then list that item with a 1 in the survey. And then at the end of the day, we add up the number of food groups out of the list of 12 that any member of the household had consumed within the last 24 hours. And so it was a total score of 12, where the higher score represented greater dietary diversity. Now, the second scale we used was the Household Food Insecure Access Scale. Now, this is a measure of food access over the previous 4 weeks. And so there's a series of 9 questions focusing on different characteristics of food access challenges. And then we asked the household whether or not the household experienced these challenges within the last 4 weeks and to what frequency. And there we measured whether they never experienced it, which would be a 0, rarely experienced it, which would be a 1, sometimes experienced it, and I'll use my pointer here, sometimes experienced it, which would be a 2, or 3 would be often experiencing it. And then we summed up the score. So each one of those questions we paired with a score, in this case from 0 to 3. We summed up that score, representing it out of a total of 27 possible points, where in this case, a higher score on the HFIS represents greater experience or the greater frequency of experiencing food access challenges. Now, the third and final scale that we use in designing our household food insecurity index was the months of adequate household food provisioning. And this is really a measure of food stability over time. And so here the question was whether or not the household had experienced any months over the past 12 months where they did not have adequate food provisioning. And the way the MAHFP is calculated then is that you would take 12 minus the sum of the number of months in which those households experience inadequate food provisioning. So the total score here is out of 12, and then the higher scores on the MAHFP demonstrate greater food stability over time. So this led to some challenges. When you look at these indices or these scales that we've reviewed, they're all on different scales. The HDDS and the MAHFP are on a scale of 12, whereas the HFIS is on a scale of 27. And so if we were to just add those numbers together, obviously the HFIS would have a greater impact on the food security scale that we designed. And then the other option that we had to consider here was how do we average these scores across these scales? And so to solve the first problem, we decided to normalize each one of these scales. So that means we brought all the scales onto the same scale from 0 to 100. And in this case, we use min-max normalization to be able to accomplish that. And I'll go over that in a second. And then the second approach we took was to aggregate the scores. And we really had three options that we looked into here. The first was just a simple arithmetic mean. We could take the simple arithmetic average of those three different indices that had been normalized. But the problem with the simple arithmetic mean is that it allows what's called perfect substitutability across the scores. Now, what I mean here is that if a household performed poorly on one of these scales, they could make up for that poor performance by doing well on the other scales. And so what that means is they can trade off their performance. Now, the difficulty with the simple arithmetic mean is that sometimes it's not theoretically consistent with the concepts that underlie the index that you're designing. So in this case, we look at the four pillars of food security, where we know that food security is made up of accessibility, availability, utilization, and stability over time. We know that the original intent of that food security definition is not that households can trade off performance, but you have to optimize across these different pillars. And so that was a problem with substitutability when it came to simple arithmetic means. We next observed the geometric mean as a possibility. And the geometric mean is interesting because it's a way of aggregating these scores that allows for imperfect substitutability, and that it's more sensitive to increases from small numbers to large numbers than from large numbers to larger numbers. And so it limits the extent to which performance can be traded off across the scores. And then the final aggregation method we looked at was the Condorcet ranking procedure. And this was a bit of a problem. It allowed us to have perfect non-substitutability in that you couldn't trade off performance, but there was a problem in its design. It ultimately would just provide a ranking of households for the total number that were in our sample, because the Condorcet ranking procedure identifies those households that would have the highest score in any head-to-head comparison with other households. And then it ranks households based on that classification spectrum. And so it's a very different approach to aggregation of scores, but also does not necessarily produce a score, but it more produces a ranking. And so that wasn't entirely helpful to us because we wanted to really assign scores for the purposes of the analysis in our paper. And so in the end, we decided to use the geometric mean for our score aggregation. So I'm just going to walk through what our process looked like. So for score normalization, we use the following equations that are used in min-max normalization to bring all the scales onto the same scale from 0 to 1. And the way to think about this is that we're taking each score on each scale and we're representing it as a percentage of the total scores possible on that scale. So for example, if we look at the HDDS, the total scores possible are out of 12. And so on the HDDS, if you receive a score of 10 out of 12, this basically would be like converting that 10 into 83%. In other words, for our purposes, it was a 0.83. And so it's representing the percentage of the total scores possible that were achieved by that one household. Now, I also wanted to mention something unique about the HFIS. If you look at the denominator on the HFIS, the bottom of that fraction, you'd see that the order is actually reversed. And you can also see the same actually at the top of the fraction as well. And that's because unlike the HDDS and the MAHFP, where higher scores denote greater food security, On the HFIAS, greater scores denoted worse food security. And so we had to actually flip the scale in this case so that it would actually, a higher score would represent greater food security. So that's the reason why that equation is slightly reformatted. So that's how we normalize the different scales. But then we have to figure out how do we aggregate those scales once they're together. And in our case, we found that arithmetic mean, we couldn't theoretically justify it. Condorcet ranking procedures actually did not allow us to effectively produce a score on food security. And so we went with a geometric mean instead. And for a geometric mean, you're basically talking about taking the number of scores that you're aggregating and using that as the root of the product of those scores. So in our case, because we had three scales that we were aggregating, it would be the cubed root of the product of the three scales. Now, there's something interesting here that we observed in that on the food security scales that we collected, it was actually possible to get a 0 on those scores. If a household received a 0 on any one of these scales, what you would find is that their entire score would then revert to 0. And so we couldn't multiply these scales together if there was a 0 on any of those scales. And so there are a number of different techniques for getting around this. We ended up using what was simplest just for preserving the relative ordering within the scale, which was that we added a 1 to each one of the scales, took the geometric mean, and then we subtracted a 1 from the overall geometric mean that was provided. And that still allowed us to preserve the relative ranking across each one of the households, although I will admit it was cutting a corner in terms of providing a perfect aggregation method, but it was a decision that we had to make in order to support the analysis. So that's how we designed the index. And when we designed the index, we started to see some really interesting observations emerge. For one, we found that the highest scores tended to be observed in Nanjing. And as we're going to see in the rest of this presentation, Nanjing represented a very interesting case of household food security when in its relationship to resource access, but then also in terms of the characteristics of its food security scores that it received. So Nanjing received the highest food security scores. We also observed the least spread in Nanjing than we observed in other cities. The lowest scores were observed in Maputo, Mozambique, where we also observed the highest spread in food security scores. So that's how we designed the index. And I want to move then to talking about the correlation analyses. And in this case, we correlated the household food security index against the lived poverty index, which is a measure of the extent to which households have gone without access to key resources. In our case, is clean water, medical treatment, electricity, cooking fuel, or a cash income over the last year. And so in other words, this is a Likert scale where higher scores represent greater challenges in accessing these resources. So compared against our household food security index we designed, we would expect if there was a strong relationship between the inaccessibility of resources and food insecurity, we would expect significant and strong negative correlations. Now, one thing that we added to our analysis here as well was we bootstrapped the correlation coefficients, which basically allowed us to calculate the correlation coefficients among thousands smaller randomly selected samples within our larger sample. And that allowed us to then start to get a sense of where 95% of the households in our sample, where they landed in their correlation coefficient. And so if you look at the correlation coefficients that we observed, we actually did observe very strong or moderate to strong correlation coefficients in the negative relationship across most of the cities, at least within the social sciences. This would tend to be a strong correlation. But the interesting point we saw here as well was that in Nanjing, this relationship was different. We didn't see that consistently statistically significant correlation. And we also saw weaker correlations overall. One of the theories we had was that this might actually be a representation of the limited spread within Nanjing. And so a small change in the Nanjing samples or the small change in food security scores within Nanjing might actually influence the kind of correlation relationship we were able to observe because there were so few food insecure households within Nanjing. But the other option is that there could be something else going on in Nanjing that might be disrupting this relationship. And so that was an interesting finding that we had. But one of the questions that came out of this correlation analysis was that we've been able to establish broad strokes a correlation between inconsistent access to resources and food insecurity, but we don't know if that's consistent across the consistency of access to those resources. So is it that inconsistent access to resources is always associated with food insecurity? Or is it also that consistent access to these resources is also paired with greater food security? Relationship work in both directions. And that wasn't something that we could easily answer with the kind of analysis that we performed. And so what we decided to do was a classification regression tree. And this is an artificial intelligence algorithm that finds the best ways to categorize a given continuous measure, like our food security index, given a series of binary variables or dichotomous variables. And so in our case, we took our resource access variables, turned them into binary variables where they represent either consistent access or inconsistent access, so that we could compare performance on the food security index across these different categories. So I'll give you an example of what this might look like. Let's say we had a test score across students that was from 0 to 100, and we wanted to compare groups of students, compare the performance on this test score across groups of students based on two variables, either level of education, graduate or undergraduate, or enrollment status, whether they were full-time or part-time. We then run a classification regression tree, which would then identify the variables that would provide the best splits, the best categorization of that continuous variable. And when I say best splits, I'm talking about the ability of a variable to divide a continuous variable into distinct groups where you have small variance within each variable. They tend to be homogeneous in their performance. And so our final decision tree might look something like this, where for the overall sample, we see the overall test score. And then for the subsample level 1, perhaps the algorithm chose undergraduate students as the level of education variable as the best way to split performance on the test. And then further splitting those subsamples by full-time and part-time studies. And so what the algorithm is doing here is it's dividing the sample into further and further smaller subsamples. So first by graduate students and by level of education, graduate or undergraduate, and then second by full-time or part-time enrollment status. So if we were to follow this along, this group here would represent the test scores among part-time graduate students on the overall test. And so we've divided, we've performed the same kind of procedure that we performed here, finding the best split according to those variables. We've done it within this subsample. And then if the algorithm were allowed to continue, we would then perform the same analysis within each one of these groups. So it's dividing into smaller samples in order to identify key subsamples within our overall sample that divides performance on some given continuous measure. Now, as you might have been able to tell, this algorithm could go on forever indefinitely until it runs out of cases to analyze, which wouldn't be particularly helpful because when you get to very small categories, you're not sure if you're just looking at something specific to the sample or if it's something that's generalizable to other samples. And so we have to use stopping rules. In our case, to avoid overfitting, we had the algorithm stop when it either reached a sample size of 100 in a parent node or a sample size of 50 in one of the child nodes. So that's how we set up the algorithm. Now, in our case, we found something very unique with the decision tree that was developed. So if we were to follow along with the decision tree, we'd see at the top here the overall scores that were observed. And the best variable that was identified was around cooking fuel access, divided into inconsistent or consistent access. And if we were to follow the splits that were made by this decision tree down, we actually find that the lowest scores were observed among households that had inconsistent access to medical care and inconsistent access to cash income and inconsistent access to cooking fuel. In this case, we found that they received an average score of about 0.495, which was very low actually on our index, if we remember the original descriptive statistics. That said, among those households that maintain consistent access to cooking fuel and other resources, we find that it was very specific to the city in which that household resided. In our case, within Nanjing, we again saw that the highest scores were in the Nanjing subsample, but in this case, among those households that had maintained consistent access to cooking fuel over the last year. So here, those households received a score of 0.87. So in general, we saw something interesting here that was added to the analysis that we did in the correlation analysis, where we find that it did seem to be generalizable across cities, that inconsistent access to resources, increasing inconsistency of access to these resources did seem to be paired with worse food security outcomes. But when we looked at the other end of the spectrum around consistency of access to these resources, the extent to which that relationship, that phenomenon was paired with food security, greater food security, was really dependent upon the city in which that household resided. And so as a result, what we generally found was that this was geographically constrained, that the relationships we observed were geographically constrained based on the city that we were observing. In this case, Nanjing tended to have the higher scores, and represented a bit of a confound for our analysis. And so in general, as a summary, this paper proposed and developed a way for developing an index of urban household food access, stability, and utilization. And we did find that inconsistent access to resources was significantly correlated with food insecurity in all cities except Nanjing. But the decision tree model then found that while inconsistent access to resources did seem to be reliably associated with worse food security, we found that increasing access to these resources was paired with food security only in certain cities. It seemed to be very city specific. And so the observed relationships may give us some indication of what we could have observed over COVID-19, where disrupted access to these key resources could result in food security or may be associated with greater food insecurity, but that would be specific to different cities around the world. It wouldn't necessarily be generalizable. And Nanjing in particular is standing out as a very unique case among the cities that we analyzed. But also the findings align with broader work in sustainable development around synergies and trade-offs, how households may trade off access to different resources, how they may invest their resources in maintaining access to some resources to maintain their food security. But it also shows us that the synergies and trade-offs we observe in sustainable development may be present at the household level as well. And that definitely requires further research. Just to wrap up, I'd like to thank IDRC, Global Affairs Canada, and the Social Sciences and Humanities Research Council of Canada for funding this research, and thank everyone on the call who is involved in making this research possible. It's great to work with all of you.
Thank you, Cameron. It's so fascinating to learn the design of this FSGM index. I think using these kind of indicators we've been using for the Hungry Cities research. I think this research that you did is a perfect example to demonstrate the potential of the Hungry Cities partnership data sets, and what can we do with all those data sets to understand household food security and also the connections with access to all kinds of resources. So now we are open the floor to the audience, and so anyone, if you have any questions, please post in chat. While we are waiting for that, Cameron, do you want to talk briefly about your fieldwork experience? It seems like this is one of the major components of this research.
Yeah, it's interesting to note because in applying that, it sounds very simple the way that we presented it, where we applied the same instrument within different cities around the world. But what we found was that going into those cities, the interpretation of that instrument was very different. What is urban agriculture? What isn't urban agriculture? What is food security? And I remember in our work together, actually in Nanjing, food security means something different when you translate it into Mandarin. I think it was more closely aligned with food safety. Is that right, Zhenjiang, from our field work together?
Yeah, I think food security has a very tricky translation in Chinese, right? Usually people understand it as self-sufficiency in terms of grain supply, not really the kind of food security we understand.
Right. And so I think those experiences kind of led me to the conclusion that I think we do need to pay attention to those local dynamics in different food systems around the world and how that then contributes to some of the observations that we make. And it's very interesting in particular to see how Nanjing did stand out as a unique case. Their food system in Nanjing was unique, that seemed to be unique compared to some of the other cities. And I wanted to ask you actually, just as we're waiting for questions to come in, Zhenjiang, if you would be willing to speak to a bit of that around the uniqueness of Nanjing, why it might be that we observe such different findings in Nanjing with high food security and then also limited variability in food security within Nanjing.
Yeah, thank you. Thank you, Cameron, for that question. I think I'm also very surprised to learn the much difference between the research, your research, and between Nanjing and other cities. Especially in the end when you do the tree, and you see Nanjing really stands out in that tree. So I think if we want to try to understand, what is unique there that makes the city quite perform so well in terms of household food security, we want to emphasize that the city has implemented a comprehensive food system planning, I would say, since the 1980s. And it's really boils down to two major policy pillars. One is called city mayor responsible for, they call it the rice bag policy, a rice bag program, which mandates that provincial level governors be responsible for the supply of grains in the province, and also the vegetable basket policy or vegetable basket program that requires city mayors be responsible for the supply of non-grain food within the jurisdiction of the city, including the urban area and also the adjacent rural area, belonging to that city jurisdiction. So it's very important that these policies have been implemented for decades throughout the country. And because of these policies, the provincial governors and the city mayors, they see this as a very important indicator of their performance, so that the government is willing to invest all kinds of resources and issue all kinds of policies to support the production of food locally, and also to support the supply of food in local markets. And they also establish new markets, maintaining the existing markets by providing subsidies to upgrade those markets. And these are what the government had been doing. For example, I think in the 2017 and 2018 plans, they require that each housing complex in a city should have a physical access to 5 different vegetable baskets or 5 different kinds of food outlets for each of those housing complex. These outlets include wet markets, fresh produce in supermarkets, affordable food shops, and also e-commerce lockers where people can order online and pick up food, and also self-pickup stores. So it's very, it's a big achievement for a city like Nanjing with a population of 8 million people to have, at least 5 different kinds of food outlets for each housing complex. This really ensures, right, people have access to fresh and healthy food and affordable food as well. Yeah, I think there's a lot to discuss here, and I see that we have a question from Jonathan here in chat. Jonathan says there is a growing tendency to abandon phantom measures led by the FAO and World Bank and use other metrics such as FIES and CSI. Could you comment on the utility and robustness of these metrics for understanding food security? And would they be amenable to your kind of analysis?
Right. Well, I can't really speak to the FIES or the CSI. I haven't actually used them in any of my research, but I am looking into other measures I could include in the surveys. I think it really depends on what your goals are. In our case, because we were trying to actually provide a measure or a representation of food security, we found that it was important to use the established measures that had been researched extensively. And so the phantom measures have been used extensively across research projects, and it allows us then to have a series of benchmarks against which we can compare these scales. And as scales are developed, perhaps there are theoretical strengths that we could explore for using those kinds of scales as well. One of the challenges we found in applying the phantom measures is we've also found in other research, there was actually a publication that the Sierra Vercelli, Sierra, who's actually on the call, she led the research here, was actually that we found that some of the phantom measures, like the HFIES, seem to actually vary based on the gender of the respondent. And this is based off research that Sierra had conducted in northern Ghana. And so one of the challenges we find in general with survey-based food security measures is that ultimately you are open to those survey biases, to the biases that come from the respondent. And so that's going to be a continuing challenge. But I am going to be looking into the FIES and CSI for future research to see if they add anything theoretically to the analysis of food security. But in our case, we chose to use the Phantom measures, one, because we had so much data on them, but then also because they provide such a great benchmark because they had been so extensively researched. So.
Thank you, Cameron. Well, I have another question for you regarding the cart tree analysis. It seems like we have cash income, medical care access, and also access to cooking fuel, but not other resources. So other resources not reflected in that tree as indicators, for splitting the FSGM score. Does that mean that those other, access to other resources are less important and that should not be prioritized in policy making for improving food security? What is your take on that?
This is a great question because one of the things that classification and regression trees are helpful for is actually for feature selection, for identifying those variables that are closely associated with the target continuous variable. And so it does help us to better understand how these variables can be used for classifying performance on the continuous measure, in our case, the FSGM index. So in this case, when we look at the variables that we include in our analysis, the particular algorithm that we use was based on minimizing the least square deviations within each group. We did find that these were the significant resources. And I can say that cooking fuel access, cash income access, as well as a medical care access, we did find in other research that they were significant predictors of food security as well. So that's been verified or validated in other research as well. But that said, we again are limited by our data. I think there are a host of opportunities available to us in researching how there are synergies and trade-offs between different resources or access to different resources within a city. And I think we really would be well positioned to explore that further going into the future, because there's a growing interest in the multidimensionality of poverty, but then also understanding the SDGs, how we can achieve the SDGs by the 2030 goal. And I think that you're absolutely right. There are resources that we haven't listed here, but may be significant to this discussion. We just haven't explored them yet. So, so yeah, I think there definitely are other resources to explore here for sure.
Yeah, thank you. Just a quick follow-up. So I think it's easy for us to understand lack of access to cooking fuel or lack of access to consistent income would affect household food security. How about the medical care? What is your explanation about, the relationship between access to medical care and household food security?
Right. So when we look at, in terms of the theory that I've developed for trying to understand these relationships, what we really need to look at is what a household might be willing to trade off food access for. And so if you have a household member that's sick, medical care, if you have a limited income, may be one of those things that you'd be willing to go without food to be able to put money towards paying for those medical care costs. That could be one option. But also along those same lines of thinking, I remember when we were in, I think it was it might have been Felipe, when we were in one of the informal settlements in Cape Town. I remember speaking with individuals there around this relationship that we had just observed early on in our research. And the notion that there was this relationship between access to medical care or inconsistent access to medical care and food insecurity. And again, that was reiterated, that is a priority. So if you have someone who is sick, you need to be able to find the medical attention. And it's often, it can be more expensive to access medical care when you're in that kind of a situation than to access other resources. So an example of this are countries where there's public and private medical care systems. In many cases, you find that private medical care may provide better quality of care or may provide better access to care or more expedient access to care, but it also will cost the individual more because it's an out-of-pocket expense. If you have lower income, you may be forced to seek medical care in the public healthcare system, which may not be as expedient or may not provide the same quality of care. And so what we see is there are these distinctions within cities that seem to divide the consistency or quality of access to these resources, and therefore how much money is put towards them relative to the overall household budget. And so those are some questions that we're exploring right now to try and better understand.
Right, right. Yeah, thank you. Jonathan has a follow-up comment. He said many of the rapid surveys conducted during the pandemic used the FIES, which could give insights into what actually happened during the pandemic as opposed to what might have happened as per your analysis.
Yeah, this is a great point. Our analysis was completely done on data that was collected before the pandemic, and I think the work that has been done over the pandemic, including some of the work that Jonathan has led as well, really provides an opportunity to understand the food security implications of pandemic, of the pandemic and the lockdowns associated with the pandemic. And so I think there's a wealth of data that needs to be analyzed there to be able to understand if these relationships that we predicted to happen did actually happen during the pandemic, and then also to see how food security might have changed over the pandemic and the predictors of those changes. I agree with Jonathan 100%. That's a great point to raise.
Yeah. Thank you. Speaking of the pandemic, so I think it's very interesting that all these surveys were actually conducted before the pandemic. So if we were to conduct this research now or during the pandemic, we did have some data from the pandemic. So would you say that your analysis result will be different? Like, for example, can we be a little bit speculative here, but the medical access, will that be a more significant, indicator for your analysis?
Yeah, that would be very interesting because you would likely have a greater proportion of the population requiring medical care access, and you would also be having, we know during the pandemic, many healthcare systems were strained, and so access to medical care was challenged. The challenge that we might run into is that we know that both of those phenomena occurred during the pandemic. We know that food insecurity did rise over the pandemic. We know that access to healthcare was challenged over the pandemic. And so what we don't know is the extent to which the association between those two variables might have been due to contextual factors, or whether or not there actually was a trade-off in household budgets across those different factors. That's a similar question to what we would have with our data analysis as it is. But I think I reiterate that, yes, that would be a very important investigation to conduct to be able to understand whether or not these relationships would hold up in that data. My guess is they probably would, because we saw both of these both resource access challenges and food insecurity rise during the pandemic. So there probably would be an association that we picked up, but then trying to use the proper analytical techniques to be able to determine what might have been associated with the changes, what might have underlie those changes. That would be an important question to ask for sure.
Yeah, thank you very much. Anyone has other questions? Cameron, do you have anything else to add regarding the fieldwork or anything related to your research? We have you have a few minutes left.
Just a shout out to say thank you very much to Jonathan Crush, who saw me as a lowly postdoc and sent me to so many cities for so much great fieldwork experience, and also for the great work that was done during the HCP that really kind of laid a foundation, or further foundation, for the MiFOOD project as well. I think there's great opportunities with the research going on in MiFOOD right now, and this is a great project to be associated with. And I'm definitely looking forward to the kind of analyses we might carry out. And Jonathan, I do see your note around methodology and the pandemic surveys in relation to the LPI. And yeah, I would love to have that conversation. I think we're well positioned to do some really interesting work along these lines.
Now we are just calling end to our webinar. And thank you again, Dr. McCordick, for sharing your fascinating experience. I'm pretty sure that we can have more collaborations in the future on the MiFOOD project and other projects regarding the data analysis and also designing new indicators to evaluate household food security. This is really interesting. And thank you everyone for joining us today. If you want to join us in the future for our future webinars, please follow us on Facebook and also on Twitter. The account is moving on empty. So please follow us there, and there will be announcements of new webinars and events. Thank you again. Bye.